Okay, let me hide the view. I'll try to catch your messages if you want to talk during the presentation, which I like interaction. What we're going to talk about today are lab values and normal ranges. And I picked this because when you're typing, the numbers sometimes sound confusing. And if you know a general number or a range that what it could be, you can tell if it's normal or abnormal. Okay, this is one of the panels that the doctor does normally when you go for a physical, or at least they do in the States. It's a basic metabolic panel, or the BMP. It's made up of blood, urea, and nitrogen, or they'll sometimes dictate it as BUN, or BUN, they'll say either one. Calcium, carbon dioxide, chloride, creatinine, glucose, potassium, and sodium. And one of these slides has where I got this information, and they're going to vary from laboratory to laboratory because I checked several internet sites and I have a lab book, and they're within a number or two, but they're not exactly the same. So the blood urea nitrogen should be 7 to 20 milligrams per deciliter. Sandra, you can get the presentation, well, not the presentation. I think they post that on the forums, but they put the handout somewhere, and maybe another student can answer that. They put a handout, I converted to a handout, and they post that for the students. Okay, Sandra says she knows. Okay, good. And suppose you heard 7 as 17. Well, that would be abnormal. So either you're not hearing correctly or it could be an abnormal value. Calcium, 8.4 to 10.2 milligrams per deciliter. And for 8, you might could hear 80 or 18. There's just different ways you can hear numbers depending on how they pronounce it. Carbon dioxide is 20 to 29 millimoles per liter. Chloride, 98 to 106 millimoles per liter. And 98 sometimes sounds like 90. Creatinine, 0.8 to 1.4 milligrams per deciliter. Glucose is 64, and that could sound like 60 or 16 or whatever, to 128 milligrams per deciliter. And I'll be honest, potassium is the only one I can remember out of these, and it should be in the 3.4 to 5.2 milliequivalents per liter. That one is the only one I can remember. Sodium is 136 to 144 milliequivalents per liter. And here's where my note is. The normal values will vary from one place to another. I did get these from this website and a book I have. It's called A Manual of Laboratory and Diagnostic Tests by Francis somebody. And I kind of got a lot of detail on the BMP because I found so much information. Why is a BMP done? It's done to test your kidney function, the blood acid and base balance, and blood sugar levels. The other names for a BMP, and you've probably done some of these in your reports, a Chem7, SMA7, and SMAC7. The BUN, and I did this on the basic metabolic panel if it's higher than normal levels and lower than normal levels, just so you would get. Jennifer says, quick, let me see what you're saying. There are 8 question mark. What are you referring to, Jennifer? Oh, Jennifer says in the BNP there are 8 things tested, but the test is called Chem 7. You know, that didn't even dawn on me, and I'll have to research that because I don't have a clue why it's called Chem 7 or even the others with 7 on it. Um, if you've got higher than normal levels in the bun, it could mean congestive heart failure. You could have excessive protein levels in the GI tract. There could be gastrointestinal bleeding, hypovolemia or dehydration, or a heart attack. Still higher than normal levels could indicate kidney disease, including glomerulonephritis, pyelonephritis, and acute tubular necrosis. Could indicate kidney failure, shock, or urinary tract obstruction. The lower than normal levels could be due to liver failure, a low protein diet, malnutrition, or overhydration. You can actually have or drink too much water. You know, they say, well, I go to this weight loss program, Weight Watchers, and they say drink either half your body weight or 8 glasses of 8 ounces, so 64 ounces. And if you go over that, you can retain fluid. For people with liver disease, the bun level may be low even if the kidneys are normal. Why do we do a creatinine? The creatinine is a chemical waste product of creatine. Creatine is a chemical made by the body and is used to supply energy mainly to the muscles. The test is done to see if your kidneys are working well. Creatinine is removed from the body entirely by the kidneys. If kidney function is not normal, creatinine level increases in your blood. This is because less creatinine is released through your urine. The creatinine level also varies according to a person's size and muscle mass. So what's normal for one person may not be normal for another person. Calcium, it plays a role in keeping your cells working the way they should. It also helps blood clot normally. Hypercalcemia is increased total calcium levels. It's caused by or associated with the following conditions: hyperparathyroidism due to parathyroid adenoma, which is a tumor in the glands, hyperplasia of parathyroid glands, or associated hypophosphatemia. The next one is cancer or PTH producing tumors. It can be metastatic bone cancers, cancers of the lung, breast, thyroid, kidney, liver, and pancreas. Could include Hodgkin's lymphoma, leukemia, and non-Hodgkin's lymphoma. multiple myeloma with extensive bone destruction, and Burkitt's lymphoma, primary squamous cell carcinoma of the lung, neck, and head, granulomatous disease such as tuberculosis or sarcoidosis, thyroid toxicosis, Paget's disease of bone, also accompanied by high levels of alkaline phosphatase, and idiopathic hypercalcemia of infancy. Bone fractures combined with bed rest and prolonged immobilization. Excessive intake of vitamin D, milk, and antacids. Renal transplant, milk alkali syndrome or Burnett's syndrome. And you can get too much vitamin D, which we get most of it from the sun, which I have to take a supplement because I work inside and I'm not exposed to the sun, but you can get too much of that. The decreased total calcium levels are commonly caused by or associated with the following conditions: pseudo-hypocalcemia, and I see a misspelled word in that, hypoparathyroidism due to surgical removal or of parathyroid glands, irradiation, hypomagnesemia, GI disorders, or renal wasting. The primary form is very rare. Whoops, I thought I could correct it, but it won't let me. Hypophosphatemia due to renal disease, laxative intake, or cytotoxic drugs. Malabsorption due to sprue, celiac disease, or pancreatic dysfunction. Acute pancreatitis, alkalosis, advanced osteomalacia. Renal failure, vitamin deficiency, rickets, malnutrition, alcoholism, and hepatic cirrhosis. The carbon dioxide increased levels occur in severe vomiting, emphysema, aldosteronism, use of mercurial diuretics. Decrease also occurs in severe diarrhea, starvation, acute renal failure, celiac toxicity, diabetic acidosis, use of chlorothiazide diuretics. Chloride, the decrease occurs in severe vomiting, gastric suction, chronic respiratory acidosis, burns, metabolic alkalosis, and congestive failure. Addison disease, salt-losing diseases, overhydration or water intoxication that we talked about, acute intermittent porphyria. Increase occurs in dehydration, Cushing's syndrome, hyperventilation, which causes respiratory alkalosis, metabolic acidosis with prolonged diarrhea, hyperparathyroidism, primary. And I don't know if it teaches you in the course about alkalosis and acidosis, but it's referring to the pH scale. The normal pH is supposed to be around the 7 range. And if it's too much, and I get these confused, it's either acidosis or alkalosis. And if it's too low, it's the other one. Select kidney disorders, diabetes insipidus, celiac intoxication, head injury with hypothalamic damage. Glucose, elevated blood sugar, which the medical term is hyperglycemia, occurs in the following conditions: diabetes mellitus. Other conditions include Cushing's disease and acute emotional or physical stress situations such as an MI, cerebrovascular accident, or convulsions. Potassium, your potassium decrease is known as hypokalemia. It can occur in the following: diarrhea, vomiting, sweating, starvation, malabsorption, Barter's syndrome, draining wounds, cystic fibrosis. Looks like I missed a slide here. Diuretic, antibiotic, and mineral corticoid administration, barium chloride poisoning, treatment of amegaloblastic anemia with vitamin B12 or folic acid. Increased potassium levels, that's known as hyperkalemia, can happen in the following: renal failure, dehydration, obstruction, and trauma. Cell damage, as in burns, accidents, surgery, and chemotherapy. Metabolic acidosis, Addison's disease, and pseudohypoaldosteronism. The sodium hyponatremia is decreased sodium, and it can happen with severe burns, congestive heart failure, excessive fluid loss with diarrhea, vomiting, and sweating, excessive IV induction of non-electrolyte fluids such as glucose, Addison's disease, and severe nephritis. Pyloric obstruction, malabsorption syndrome, diabetic acidosis, drugs such as diuretics, and edema. Again, large amounts of water by mouth, water intoxication, stomach suction accompanied by water or ice chips by mouth, hypothyroidism, excessive ADH production. Hypernatremia, which is increased sodium. These are uncommon, but when they do occur, they happen with the following conditions: dehydration and insufficient water intake, Conn syndrome, coma, primary aldosteronism, Cushing's disease, diabetes insipidus, and tracheobronchitis. Okay, the complete blood count. The hemoglobin is measured in grams per deciliter, and it listed two different values for a male and a female. It's 13.5 to 16.5 in a male, 12.0 to 15.0 in a female. The hematocrit is a percent. The male is 41 to 50 and female is 36 to 44. And I'll tell you a little trick about the hemoglobin and hematocrit that somebody told me years ago. If it's normal, say if the hemoglobin is normal, the hematocrit will be 3 times what the hemoglobin is. So 13 times 3 is 39, so it's close. And 12 times 3 is 36, so that's right on it. So if they're both normal, that's what it should be. The RBCs are measured times 10 to the 6 slash milliliters, which I can't begin to explain that, but the male is 4.5 to 5.5, and the female is 4.0 to 4.9. The RDW is the red blood cell width, and it's less than 14.5. Okay, I see some chats. Okay, Lisa says, if dictated hemoglobin as 12, do we put 12 or 12.0? You put just 12 unless he says the 0.0, Lisa. And I know they don't normally, according to the book of style, want that trailing 0, but it reads something to the effect that, let me see how it's worded. If the dictator says it, for preciseness, you should put it in there. Okay, Jennifer's LOL. She must be laughing at us. Then she says sorry. Coralie says otherwise it could be confused with 120. That's right, Coralie. But if he dictates it, you need to put it on there. The MCV is the mean corpuscular volume, and it's 80 to 100. You don't always see this in a complete blood count, but I found it on the internet. The MCH, I think, is mean corpuscular hemoglobin, and it's 26 to 34. The mean corpuscular hemoglobin, can't remember the C. It's a percent, and it's 31 to 37. The platelet count is 100,000 to 450,000. Coralie says hematocrit, and that may be right, Coralie. I looked it up and still can't remember. And on platelets, I don't know if you've come across in reports, but I have working where they won't say the 100,000, they'll say 100 to 450 and assume the transcriptionist knows it's 100,000, which you don't type it if he don't say it. If he says 100 to 450, type that, cause of verbatim, and you'll probably do it different when you go to work. The urine test, the color is normal to pale, is pale to dark yellow. The clarity is clear. You won't see pus in it. The odor, which I've never heard this before, it says slightly nutty odor. Specific gravity, the normal is 1.005 to 1.030. And I'm sure you've heard a doctor say 1005 or 1030, and he assumes you'll put the decimal in the correct spot. They're bad for that. The pH should be 4.6 to 8.0. There shouldn't be protein in the urine. The glucose is negative. There shouldn't be any ketones. When they do a microscopic analysis, there's very few or no red or white blood cells or cast. There's no bacteria, yeast cells, parasites, or squamous cells present, and a few crystals are normally seen. And some people, their normal urine test, and I'm one of them, I always show a little bit of blood. I have interstitial cystitis, and that's what they think causes it. so it's nothing to get concerned about unless it's a large amount. There shouldn't be any bilirubin or nitrites or leukocyte esterase. The microscopic exam of the urine, they usually take several drops and put them under a microscope. If any of the following are observed in higher than normal levels, other testing might be necessary. White blood cells or leukocytes can be a sign of infection. Red blood cells or erythrocytes may be a sign of kidney disease, blood disorder, or another medical condition such as bladder cancer. Epithelial cells, they're cells that line your hollow organs and form your skin. If they're found in your urine, it might be a sign of a tumor. More often, though, they indicate that the urine sample was contaminated during the test and they need a new sample. Bacteria or yeast can indicate an infection. Cast are tube-shaped proteins, and they can form as a result of kidney disorders. Crystals, they form from chemicals in urine and may be a sign of kidney stones. The liver function test. They're blood tests used to help diagnose and monitor liver disease or damage. The tests measure the levels of certain enzymes and proteins in your blood. The alanine transaminase, or ALT, it's an enzyme found in the liver that helps your body metabolize protein. If the liver's damaged, ALT is released into the bloodstream and levels increase, and it was formerly known as SGPT. I don't know if the reports are old enough to have that, but they changed it to ALT. The normal is 7 to 55 units per liter. The AST, or aspartate transaminase, it's an enzyme that helps metabolize alanine, an amino acid. Like the ALT, AST is normally present in blood at low levels. An increase in the AST levels may indicate liver damage or disease or muscle damage. The normal is 8 to 48 units per liter. The alkaline phosphatase, and sometimes they'll abbreviate this and say ALK-phos. The ALP, it's an enzyme in the liver, bile ducts, and bone. Increased levels of ALP can indicate liver damage or disease, such as a blocked bile duct or certain bone diseases. The normal is 45 to 115 units per liter. And most of the time, I don't think they dictate what the measurement is in, like units per liter or milligrams per liter. I think they just give the number. Corley says, I ended up with high liver enzymes recently because of a medication I take. Okay, and that makes sense because a lot of the medications have different side effects, as we all know. You're trying to take something for one thing and it causes something else. The albumin and total protein in the urine. Albumin is one of several proteins made in the liver. Your body needs these to fight infections and to perform other functions. Lower than normal levels of albumin and total protein might indicate liver damage or disease. The normal albumin is 3.5 to 5.0 grams per deciliter, and the normal total protein is 6.3 to 7.9 grams per deciliter. Lisa said it also depends on whether dictated in SI units or conventional units. Okay, good point. That's true. The bilirubin, it's a substance produced during the normal breakdown of red blood cells. It passes through the liver and is excreted in stool. Elevated levels of bilirubin, such as jaundice in a child or baby, might indicate liver damage or disease or certain types of anemia. Lisa says Merck's MERKS has charts for normal values you can print out in both. Okay, you might want to show the website. Let's see. Lana says she has a chart that shows total serum protein 6.0 to 8.8 grams per deciliter. Oh, Tina says when it says capital U/capital L, I thought that unit was always supposed to be written out, so not unit per liter. And I was going by the table that I was getting it from, Tina. That's an error on my part. Okay. I don't know if we said, but the normal is 0.1 to 1.2 milligrams per deciliter. Okay, I see another chat. Lana says, I don't know if that's pronounced Gilbert's or Gilbert's syndrome. My bilirubin is usually high, but since I had a full body cleanse and natural remedies for cancer, I now have normal bilirubin. Lana, that's interesting because most doctors don't believe in the natural remedies or herbs and different things. Lana says, P.S. and no cancer. That's wonderful. I take melatonin. I guess that's called a natural thing to sleep. Carly says, congrats, Lana. That is wonderful. You have to be careful with the herbal products, though, because they interfere with if you take other medications, such as blood pressure or depression or some of those it interferes with. Lana says, praise the Lord. Okay, the gamma, and I'll attempt to pronounce this, glutamyl transferase, or the GGT, it's an enzyme in the blood, and higher than normal levels may indicate liver or bile duct damage. The normal is 8 to 48 units per liter. The L-lactate dehydrogenase, or LD, it's an enzyme found in the liver. Elevated levels may indicate liver damage but can be elevated in many other disorders. The normal is 122 to 222 units per liter. And if you can find, like Lisa was saying, Merck's had it, if you can find a good chart, I used to have one, but I don't know where it is, that's got all of the normals. It's really handy when you're transcribing so you can see, did I hear that number wrong or did the doctor say the incorrect number? The prothrombin time, or PT, it's the time it takes your blood to clot. Increased PT may indicate liver damage, but can also be elevated if you're taking certain blood thinning drugs such as warfarin. The normal is 9.5 to 13.8 seconds. A few years ago, I had a blood clot to the brain, and I had to take Coumadin or warfarin. And if you ate certain foods like greens, it messed up your PT time. Green vegetables. Corliss is also called pro-time. That's right. So it was hard. Mine kind of bounced around, and I even ate ice cream a lot one night, and it messed it up. Anything with potassium messes it up. And that's all, and we've still got 24 minutes. I never know how to judge these. So, any questions or comments, or I'll take suggestions on future webinars too. Somebody has told the director that you all want to see the different specialties, procedures that are done in the different specialties. So I think we're going to work, each instructor is going to work on some of those. Lana says we are pretty quiet so far today. Shara says, don't we use trailing zeros with lab values only? If it's dictated with other things like medication, we still don't write it. Let's see if I can find it right quick in the book of style. I think if they dictate it, you need to put it regardless if it's a medication or whatever. Let me look up numbers and see if I can find it. Sandra says, I am because I just completed the surgical chapter. Good for you. I know that chapter's a beast. Tina says, again, will this information be found in the forum? It will, Tina. I don't know how long it takes for them to post it, but it will be in the forum. Lisa says, here is the link to the printable charts on Merck's if anyone is interested. Ann says, way to go, Sandra. And Lisa has posted the link in the chat box. Oh, Cher says it's in account specs. Well, you better do what the account specs says before the book of style. And of course, I can't put my hands on mine right now. Yeah, the account specs trump the book of style. Tara says, thank you, Lisa. Sandra says, thanks. Lana says, thank you, was just looking for it. Ann says, thanks. And Shara's in a different platform than some of you, so she's got different account specifics. And of course, I can't put my hand on mine. Here it is. Coralie says, that's awesome, Lisa. Thank you. Betty says, thanks, this is good info to have. Lisa says it's the professional version, and if you missed the link, I posted in cardiovascular forum. Cheryl says, thanks. I'm looking, Lisa, on the account specs. Not Lisa, Cheryl. Lisa says you're all welcome. And Lisa says Robin is actually the reason I posted it so long ago. Well, I don't remember that, Lisa. I know I've talked to you on chat, but I don't remember. Carol says page 7. Thank you, Carol. Oh, okay. Yeah, follow the account specifics. I see it. Biggest day. Oh, Lisa says I mentioned once you couldn't find a good site before. And you would have thought it would have been like a table. I have the Stedman's lab book. You would think it would be a table in there, but there wasn't. And my other lab book has them all mixed through the book. There's not a table. You look up in the index what it is. Oh, Lisa said it was in here in the topic webinar. Well, good. At least I know somebody got something out of what I said, and you helped all the others. Do you all have any suggestions for something you'd like to see in a webinar since we got some extra time? I have done one, I think once, and had it in exactly the right time. Lana says speed type. Crystal says thank you. Lana, I think Glenda has done a couple on speed type, but let me check with her and see. They'll be listed in the forum if there are. Sandra says punctuation, specifically commas. I don't want to be the one to do that. I hate commas, but I'm going to write it down. And Carol says hyphens. Sandra says me too. Okay, maybe we can do a combination of hyphens and commas. Corley says nice use of commas, Sandra. Okay, Helene's left. She says have a good day, everyone. Oh, Lisa, expanders would be a good one. Now, I have a crazy system on expanders, and nobody would figure it out but me on what I do. You're welcome, Monica. Kate says expanders would be a great topic. No problem, Monica. Monica put a Y in my name instead of an I. Well, you all can go if you don't have any more comments or questions or anything. I'm sorry I've run out early. We've got about 16 minutes left, so that's not too bad. Coralie says, I would love to understand the procedures better. I'm a super visual learner. Coralie, that's what Joan Leakey had suggested to the instructors that, that a student wanted to have like a question and answer session and talk about procedures. Now, I can't rattle off the top of my head how procedures are done. Oh, Coralie says that was you. Okay, well, she listened to you because she told the instructors. So I would have to look up some things to be able to explain it. Coralie says, yay. Yes, if you tell somebody something, they do listen. It may take a while. Kim says, signing out too as the audio keeps cutting in and out. Lots of rain in northern Ontario. Okay, Kim. Well, Coralie, we're working on it. Each one of us has got several specialties we're supposed to look up procedures and do. You have a good day too, Sandra. You're welcome. Coralie says, thanks, Robin. Love it. Lana says, snow here today. Okay, what did Ann say? You only ran out early because we were quiet today. Thanks for the info. Yes, you were all quiet, and that does take up time when I have questions. Bye, everybody. Oh, Lisa says she's been having issues with the site going in and out like crazy since we switched to Firefox. I'm having issues with Firefox too. Carol says, when it comes to lab values, can a session be about when to use comma between and when to start a new sentence? Carol, if you're still here, you can do the lab values. Well, let's see, that's kind of difficult. Some companies want you to group the lab values together, like the basic metabolic panel, and end it, and then do the complete metabolic panel or the urinalysis and end it. And some you can separate it all by commas, and either way is acceptable. Okay, Coralie said she would like that too. I'll write that down. Lana's got to finish a test. Good luck, Lana. Tina says that messes her up. And Lisa says, oh yeah, Carol, that would be awesome. I've had programmed my expanders with them. Punctuation groups would kick butt in that situation. Okay, so punctuation in lab values. Okay. Okay, well, you all have a great day, and I'll see you the next time it's my turn. Thanks for the website, Lisa, and letting them know where it was.